Aloha. Thank you for tuning in to episode number 4. My name is Christina Estrada, partner of Booyah Marketing, where we have deeper connections. Today, our honored guest is Suzanne Kellner Zinck, with 30 plus years of experience working in mental health, specializing in holistic healing through hypnosis, helping clients quickly address the root causes of emotional illness when traditional mental health approaches have failed. She works with anorexias, bulimics, and sex addicts to overcome their disorders permanently and enjoys assisting teens and college age clients who respond well to hypnosis. Public speaker, author, podcaster, and a mover and a shaker, setting souls free to live their purpose on purpose. How are you, Suzanne?
Doing very well. So great to be here with you,
Oh,
Christina.
so honored. Thank you. So, how did you get into the world of hypnosis?
Well, I'll tell you. For many years, I had no idea what my right to work was to be. And I ended up doing some informational interviews at different places. And one of the places was a place that was a clubhouse for mentally ill adults. We saw almost 200 people coming in and out of this place in the 4 programs they had because these people really were not safe to be on their own for an entire day.
Mm,
And this was wonderful. I had great mentors. I had great people working with clients that really cared about what they were doing. And of course, we had people who had multiple problems. And I had what we call in psychology, psychiatric comorbidities, and sometimes with drug addiction on top of their multiple mental illnesses. So it was a fascinating place to work, and I learned a whole lot. And basically, if you don't learn how to have boundaries
mm,
and take the stuff they say to you personally, you'll be eaten alive by
mm.
some of the people with personality disorders and some of the drug addicts. So you learn very quickly to build a hard shell. But then it was only 1 year contract, so I had to leave. So I went to supported housing programs for mentally ill adults, and one was worse than the next. And it got to the point where these directors were just very, shall we say, controlling. They wanted to be little dictators over these people. They were very dismissive, demeaning, and because a lot of these folks are on Medicaid, over medicated on drugs by psychiatrists who just didn't care whatsoever about these clients. It was pretty abundantly clear when a psychiatrist one day asked me what was going on with my client. I'm like, your patient's right here. Ask them. They'll tell you. If you need an interpretation, I'll give it to you. No problem. So I wanted to find a different way to help people. And
Mm.
actually, I had been diagnosed with what's now known as bipolar 2 back in the day. Before bipolar existed as a diagnosis, it was manic depression. And that was back in like 1989, so a really long time ago. And all I knew for myself was I didn't want to be seeing a psychiatrist and on meds for the rest of my life, and I didn't want to be leashed to a psychologist forever either.
Mm.
So I knew there had to be a better way. I just didn't know what that was. But I never gave up looking. And it so happened I had this opportunity to go and find the treatment I needed to get rid of the bipolar 2.
Mm.
But before I even did that, I had actually started working in hypnosis. I went to nursing school, found out how the body works, found out about how important nutrition is. If you don't have amino acids, you're not going to be able to think clearly and have what we call emotional regulation if the amino acids are not metabolized correctly. And the same thing is true of certain vitamins, especially the B vitamins. So I had that, and I had started working in the hypnotic field before this opportunity came along for a couple of years. We went out to do this wonderful work with Tad James, who is, well, he wasn't my trainer, but he was the father of my trainer, neurolinguistic programming and timeline therapy, which Tad actually developed timeline therapy. Wonderful technique. And I didn't realize it at the time, but he realized it. And he said to me as in front of him, in this little group of people that were doing this work all on ourselves, to be the best practitioners we could, he said, Suzanne, how would you like to get rid of your manic depression? Because I had a client 20 years ago who had it for 20 years and he got rid of it. And I said, hell yes. What do I need to do?
Yes,
And he
yes.
said, timeline therapy, I just have to tell you what the 3 negative emotions are that you need to get rid of, and you can do it. Now, this is the problem. I was so depressed. My marriage was falling apart after 17 years. I couldn't think how to do it. And so I asked him if Matt, his son, who was my NLP trainer in the room, would just help me do the first one so I could recall how to do it correctly, right? Swear to God, Todd looks at me and says, you know, Matt told me that you've been doing this for a year. What is your problem? I said, it hasn't been quite a year, it's been about 8 months. And I'm depressed, Todd. Do you understand when you have depression, you can't think clearly? Obviously, it's part of the problem.
Hello.
So Matt reluctantly helped me do the first one, which was anger. Then after that, it took about 5 minutes. I cleared it. And then the next homework was
Wow.
to go to my psychiatrist and get off the medication safely and fire her when I was ready to. That was the homework. So March 12th, I remember the date because we had done this intervention February 14th. It was around Valentine's Day. I had my appointment and I just told Dr. Jones, who I'd been seeing for like 13 years of the 14 I was under psychiatric care, that I wanted to go off the meds.
Mm.
And she was okay with that, especially after finding that the meds were causing problems with my kidneys slowing down anyway. So she
Oh.
discontinued them immediately, threw me on another medication, which I was only on for a little while until Matt or Tad told me to have her take me off them. So at that point,
Mm.
she did take me off them. And I had her follow me for like 10 months until I was so bored trying to get across the different main arteries of Boston to get to her lovely office. It was a very nice office in Brookline Village to get what little I was getting out of it. So I terminated my services with her. And she gave me some very important information that I did not ask for. She said, you know what? I learned some stuff working with you, Suzanne. Would you like to know what that was? I said, by all means, please tell me. And she said, I've learned that people with manic depression don't need to necessarily have this illness for the rest of their lives because, frankly, you don't have it and you haven't had it since you came back from your time from
Wow.
being treated by your neuro-linguistic programmer trainer. She didn't remember his name. It was okay. And that was really, really good information.
Yeah,
So
no kidding.
I had a way to treat myself at this point that worked. And I wanted your people to know that since 2004,
Wow. Yeah.
February, I've been fine. And you know you're fine, that you don't have any manic depression or bipolar, same illness, because you're not having extreme lows or you don't want to get out of bed and do anything and you don't have any energy to do anything. And you're
Mm.
also high, you're doing really idiotic things because you actually have no judgment and you don't care. You just want to have fun. It's playtime. So I can honestly tell you all that it has not been a problem for all of these years.
Mm.
But I also found that I was able to, in I don't know, the July after that particular thing happened in February, I did do my master practitioner training at that time, and a brand new hypnotist helped me get rid of bronchial asthma. I was coughing my guts out. It was really terrible. And all she really had me do was do morning ritual. She wanted me to do meditation. I couldn't meditate. You know, if you have kind of a bipolar mentality, your brain is all over the place. It doesn't work. You got to do something with your brain. So when you're in hypnosis, there's always a purpose. So I could do different things, future pace for the things I wanted to make happen, get rid of the people in my life that I didn't want to have happen, and do some things just to not have things be bothersome. So that was all really, really good and it worked out really well. And I haven't had any bronchial asthma since then, other than if I'm overtired or if I have a person in my life who doesn't need to be there anymore, just toxic, and I know to get rid of them at that point. So it's actually a really good indicator. And now that I'm in Albania, away from all the crazy people, I haven't had any problems at all with any bronchial asthma at all. And because I can
Wow.
spin, because I'm 6 hours ahead of the East Coast and I have to deal with people in America 6 to 12 hours behind me, I have plenty of time in the morning to do what I want to do. So there you go. It's
That's
worked out really fun.
beautiful. So
But
there's a lot you can do with hypnosis.
well, there's one more that's even
Oh,
more amazing to folks.
okay.
And that has to do with having a 2.2 centimeter non-cancerous brain tumor, as a meningioma. And this went away because it finally dawned on me one day, why am I not using the visualization opportunities that I have that I know how to do with hypnosis? Because my mentor, Dave Gilgun, who never taught me hypnosis, he just mentored me, made sure I became a hypnotist, so the world can thank me for him. So me to do that. He worked in oncology at Bethesda Hospital. And he was always helping his patients to visualize stuff away or get the cells all together. So if they're going to go in there and do the surgery to take them out, that they'd all be in one place. But I just wanted to visualize those suckers away. And I'll tell you, 2-year MRI, The doctor basically told me if it was any smaller, it wouldn't be there. And that was back in 2011. So my guess is it's all gone. So
Wow.
three chronic conditions, the medical world had no idea how to help me, and hypnosis and NLP got rid of them for me. So my clients know that if I was able to do it for myself, I most
Yeah.
probably help them do what they need to do for themselves as well.
Oh, absolutely. So what is neuralistic programming?
Neuro-linguistic programming is a form of hypnosis.
Mm.
Some NLP people don't understand this, nor do the hypnotists. But basically, we are bypassing the prefrontal cortex of the brain. We know this from brain scans, how hypnosis works, okay? Your prefrontal cortex is actually where your reasoning, your rationalization, your judgment, and basically how you perceive others in your world happens. When we bypass that with hypnosis, what we're really doing is we're going into the amygdala of the brain where your emotions are, most especially anger. A lot of people have anger issues. And your hippocampus, where your very imperfect memories reside. And if your memories come from when you're really young, they are going to be even more imperfect because children do not remember things the same way that adults do because their brains are not completely formed until 25 for females and 26 for males on
Wow.
average.
Really?
So basically what we're doing is we're taking people's ideas of, oh, let me just start this way, okay? We have five senses, right? And the five senses brings in way too much information for us to be able to process at once consciously. So what we do is we basically get rid of a lot of it. We dismiss a lot of it because we cannot hold all that information. And what that does is it distorts a lot of our memories. And if you've ever gone to a place with a family member or a friend and you had totally different ideas of what happened at that same event, well, that's why, distortion.
Wow. Okay.
It's also, as I said, where our imperfect memories reside. It's where our belief systems are and our values are as well.
Mm.
So what we do is we take this information that resides in our internal representation. This is how we recall things and what it means to us in terms of how we relate to the events and the situations. And we shift from a negative internal representation to a positive internal representation by helping clients get positive learnings off of the negative events in their lives, limiting beliefs. And then I go into inner child work and forgiveness work as well, doing deeper hypnosis work. That's not NLP, but it's actual hypnosis.
Oh.
And that is what NLP is. It's a beautiful thing. It works like really quickly in a lot of situations. However, I personally feel that deeper work is necessary because NLP is done in a very light state of trance, sort of like when you're reading a book or watching a movie or something of this nature.
Okay. So for the viewers that are watching out there, what is your ideal client?
Well, my ideal clients are people who are sick of being sick of being stuck.
Mm.
And they don't understand why they're having these problems. And as you said in the intro, I have innovated with anorexics, bulimics, and sex addicts. When they come to see me, they are totally done with these illnesses so far as they actually follow the entire protocols. You know, for anorexics, it takes about 8 months on average. Bulimics, it takes about 6 months. Sex addicts, 4 to 6 weeks, they can be done with it. There's no reason for them
Wow.
to have these issues or have these very, I don't know, stigmatized problems any longer. It just need not be. And I'm happy to tell you, I've helped many sex addicts get back with their families instead of looking
Hmm.
for very, shall we say, I don't know, they don't have any connection with these people. I don't understand why on any level. So they go back to their families and they spend more time with their kids and their wives, which is beautiful. And I've also helped quite a few of them to be able to come into really great relationships, getting married and staying married. And I know because I'm on LinkedIn with some of these people, I get their updates. So it's very lovely.
Wow, that is truly amazing. So I'll put Suzanne's contact information in the description box below. Please click the subscription, notification, and thumbs up. Booyah Marketing, a hooey ho. Until we meet again.